of what is here as far as coronavirus is concerned. So they have a situation report that is updated very frequently, and the situation in numbers are also given here. We have globally 90,890 confirmed, and we have 19,222 new cases right now. In China, 80,304 confirmed, 130 new. We have 2,946 deaths so far, 31 which is new. Outside of China, 10,556 confirmed cases, of which 1,792 is new. 72 countries, we have 8 new, and also 166 deaths, 38 which are new. And we can flip over just to see the distribution of COVID virus. Just moving on up here a bit, you have this particular chart that you're given as well. And moving on, you have surveillance, confirmed and suspected cases of COVID-19 acute respiratory diseases reported by provinces, region, and cities in China. I'll just give you the top here, which is Hubei, population of 5917. Confirmed cases so far, 114. We have deaths, 2834. And we're given to understand also that the reports of new infections also is really going down as far as China is concerned. And the list goes on and on. We can go now to other regions. West Pacific region, we have Republic of Korea. No one has died so far. And the last, Republic of Korea, actually, total deaths is 28, I should say. Okay. Yeah, and total new deaths so far is 6. Days since last reported case is 0. I was reading elsewhere there. In Europe, Italy, that particular figure has risen so far, 17 as it stands right now. And the total confirmed cases is 2,036. We have also, let's just go to Thailand, look at Southeast Asia region, where we have Nepal and Sri Lanka. We don't have any cases in these particular regions as it stands right now, save for Thailand, India, and none, but we have 43 cases which are confirmed, 5 in India. And in Africa, we have Algeria, which is leading with 4 cases right now. Also Nigeria, none, and Senegal as it stands. This is now the current state of play within the 24 hours, an update from the World Health Organization. I want just to rope in Dr. Mustapha, who can give us actually a clear picture of what is happening elsewhere. He is from Japan, and we know Japan also have gone and taken extreme measures as far as even the closure of schools as it is right now. Maybe you can give us a clear picture in terms of preparedness and comparing it with our country here and the region.
Thank you.
How do you stand?
Thank you, Dibal. Hashi was very scared of me this morning. He didn't want to come anywhere near me. That's right. Yeah, Dibal, first of all, outside of Wuhan and Hubei's areas of China, South Korea and Japan are the other 2 epicenters of this challenge of coronavirus. But you can see the levels of preparedness that I saw in Tokyo is very high. There is no panic at all. So the information that is given to the people is the correct information, what they need to do and the precautions that they need to take. Everybody is in a mask, and the way the health officials at the airport, at train stations, at everywhere, you can see that they are very serious about engaging and trying to, and population following what the government is actually saying. The schools, all schools have been shut, so that means 12.8 million school kids out of school, the 35,000 plus schools across Japan, in order to contain the virus. And it's not a lot, actually. You only have that virus in the Diamond Princess cruise ship, and that's really was the petri dish for this particular virus of the Yokohama prefecture, and a few other cases in Hokkaido, in the northern parts of Japan, and Tokyo. But you can see how fast the Japanese government has moved to try and contain this. This is something that we need to learn here. I understand the president actually disbanded one of the committees and formed another one. We are always very slow. Thank God that this virus hasn't come to sub-Saharan Africa. There are many people who are saying, and with conspiracy theories, that if you're black, you can't catch coronavirus. That's nonsense. You know, if you catch this and if it comes, then we will be in deep trouble. Having said this, Dibal, there are, you know, the highest number of people have died in a day is about 108 people. You know, 137 people die every day of snake bites. So many others, 20,000 plus cancer-related deaths. So there is no need to panic about this disease. What we need to do is to take precautions. If you get in a place that you suspect you're going to be exposed, wear a mask, wash your hands, use the hand sanitizers, and we all will be good. Yeah.
All right, let's hear from Dr. Mustapha. Talking of snake bites, we know also the World Health Organization has reported that a dog in Hong Kong also has been infected by the virus as it is right now. I'm just worried with the stray dogs that we have in this country. if this really happens, Dr. Hassan.
Yeah, well, I agree that a lot more people die of snake bites than those who are dying a day of coronavirus. And we should not panic very much, except snake bites don't have ability to multiply overnight. You know, coronavirus does, and so it can get into millions, you know, very quickly, just like Ebola. Now, I think, you know, God forbid it doesn't come around here because, you know, as Africans and developing countries, we don't just have sufficient resources, frankly speaking, to deal with it. And that is why we really have to take precautionary measures, you know, to ensure it's not just people who are coming through the airports, but also people who are crossing borders, because we don't know where they're coming from, to just be ready for that. And that's going to take extensive screening. It should not be taken for granted. Now, and the reason I'm saying this because about two weeks ago, my brother was flying in from the US, and he said in some places they were not even, you know, screened. And yet when you're flying from Eldoret, you get screened, you know, at the airport. No, so this is an international flight, it's coming in. You know, why should we be lax about it? And I don't think that's a government policy. I think just someone is not doing really their job because the government understands the gravity of the situation. So I think we should give people information constantly, not one day, but it's something that has to go out there every day in terms of updating and what we should do in case you have this and these signs. Put it in languages, put it on local radio stations and stuff like that in mother tongue, so people can actually be aware. So in case someone experiences something, they can actually know, no, this is not malaria, because, you know, an average Kenyan, when they feel a little bit sick, this is malaria. Okay. So I think we should educate the public to be aware.
I really agree with Hassan. I think that's critical. I work in communications, and I haven't yet seen the mass communications that is needed, so that there's a 5-point bullet that tells you what to do, how to do it, as Dr. Mustapha was saying. I also think that the military, our military should be out into the borders and enforce a very strict discipline. I think they should be at the airports. I think they should be at the ports. I think we should absolutely take really huge steps now so that we can save later. Because if we are lax now, if it hits us, then the cost is going to be massive. So I think that it's critical that the entry points and the planes that are coming here, and one of the things that the government has to do is not tell us that it is in the national interest for a plane to land here. There's no national interest more important than the people of this republic. No. If there's a plane that's coming over there and there are people who are not well, or if there's anything to do with it, I mean, they have to find a containment procedure until we know that they don't have it, and then maybe they can be released. But in the first place, those planes and those people should not come to this country until this virus dies out. And there's no national interest more important than the sentiments of the people of this country. And that's very, very important for all of us to recognize, from the top leadership to the normal person in this country. Last point about, I think that the coronavirus is it's not yet peaked, but it will. And I think that it's coming. And the more we're prepared, the better we're going to be at making our people safe from this virus.
Right.
The last time we had a major crisis globally was 1918, when there was influenza, and 300 million people were affected, 50 million died. That's a ratio of about 30%. As Mustapha said, if you look at the trend of what's happening in terms of mortality, it's around 2–3%. So what am I trying to say? I think if you listen to that clip from Seattle, the people are saying that the challenge now they have is more fear than actually the actual problem, which means in terms of global action, we have failed. We have failed to come up with very clear protocols on how to handle. Each country is now managing this thing separately. You talked about Ebola experience. I happen to have been involved at the African Union on Ebola, and in fact, I want to thank Tedros, our brother who's in the WHO. By that time, he was foreign minister, but he had been minister of health, and he did the sterling job. And that's how we ended up, you know, getting him elected as WHO. There is lack. WHO should have been in the forefront, and he has done it, but nobody's listening. If you see, the major powers went ahead and announced, when they saw what is happening in their stock markets, the economy was being hit, that's when they moderated. And I think now if you see what is happening, particularly in America, they are doing the right thing. But initially, they are the ones who are responsible for this panic that was around, when they went politicizing and the rest. But let's say one thing here now. Dibal, there are procedures. They say this disease is manageable. Let's not cause panic. Let's not stigmatize. In fact, even in your nation yesterday, I met some ambassador who was really frustrated even with you, saying China virus. Let's not stigmatize. I lived through Ebola, and I want to thank Kenya for having even sent our men and women who went to Liberia to do that. When as an African you traveled, people scared of you. I'm now starting to lynch people in the streets. That is wrong. There are protocols, as it has been said. If you see, in terms of international travel, there are protocols that anybody traveling, surveillance should be there, checking and the rest. But let us not stigmatize, let us not cause panic, let us go for simple health measures, washing your hands, you know, making sure you don't cough loud and you don't affect people around.
No,
yeah. Well, I lived for 9 years in Pierce County, which is bordering King County. The state of Washington was the first state to have a Chinese-born governor. There is a very huge concentration of Chinese national. And the point that ambassador is talking about is happening in America today. People stigmatize Chinese and associate it with this thing. It's already happening in America. And it is very easy, thank God it didn't originate from Africa, because by now everybody would be running away from Africa. The most important thing we have talked about here this morning is preparedness. Like what Mustapha just said of Japan. Every radio station, every television station need to devote the time to talk about this. And the government health services need to come and talk to people, calm the nerves down, but talk about precaution.
Yes.
Because it's the thing has not picked. We don't know where it's going to pick.
Thank you. Right. We just want to run you by the clip.